So good afternoon, man. Good afternoon, classmates. Our topic for this afternoon is all about the ligaments and connective tissue of the female reproductive and their functions. So ligaments, the female reproductive tract. The ligaments, the female reproductive tract, are a series of structures that support the internal female genitalia in the pelvis. So we have the ligaments. The ligaments, the female reproductive tract, can be divided into three categories. We had the broad ligament, the uterine ligaments, and the Farian ligaments. So, a broad ligament, a sheet of peritoneum associated with both the uterus and the ovaries. Okay. Um, okay. Ang broad ligaments, it is a layer of a tissue that connects the side of the uterus to the walls and floor of the pelvis. So, ang broad ligaments is nagaka-cover siya sa uterus, sa ovaries, ug sa fallopian tubes. And also, it the nerves and blood vessels includes to these organs. Ang function sa broad ligament is para or to hold the uterus in its normal position sa pelvis and para ma-maintain or ang connection ni fallopian tubes to ovaries and the uterus is kuan siya strong jud. Okay, so uterine ligaments primarily associated with the uterus. Okay, so uterine is the part between the cornu of the uterus and the labia majora. Ginatawag po ni siya nga ligamentum teres uteri, and kani siya is kanang taas siya kesa sa ovarian ligament. So ang function ni uterine ligaments is pinaka-importante ni siya to provide passive support. So in minimizing the movement of the body o sa cervix. So sa uterine ligaments naga-maintain sa the uterus in the typical inverted and anteflexed position directly on top of the bladder. So this provides a support for the uterus when the abdominal pressure increases. So next we have the uterine ligaments. I know. Ovarian ligaments. Ligaments primary associated with the ovaries. So si ovarian ligaments, it is a part between the cornu of the uterus and sa ovary. So ovarian ligaments is remnant of the gubernaculum lying within the mesovarium that attaches the ovary to the lateral surface sa uterus between the uterine tube. So ang proper ligament sa ovary is ginatawag nga utero-ovarian ligament or ovarian ligament. So kani nga ligament is nagakonekta siya sa uterus padulong sa ovary sa female body. Okay? So, ang ovary ligaments is naka-attach sa posterolateral aspect sa uterus. Okay. So, nakalocate siya sa ovary inferiorly nga connected sub sa side sa uterus. So, structurally, it is a fibrous band of tissue that lies within the broad ligament. Okay. Collectively, these ligaments are tough and non-extensible. They act to support the female viscera and provide a conduit for neurovascular structures. Okay, broad ligaments. The broad ligament is a flat sheet of peritoneum, na siyang the yellow one, associated with the uterus, fallopian tubes, and ovaries. It extends from the lateral pelvic walls on both sides and folds over the internal female genitalia, covering their surface anteriorly and posteriorly. Na naka-fold siya diri dapit sa taas. Then, ang subdivision sa broad ligament. Okay, first we have the mesovarium. part of the broad ligament associated with the ovaries. It projects from the posterior surface of the broad ligament and attaches to the hilum of the ovary, enclosing its neurovascular supply. It does not, however, cover the surface of the ovary itself. So, ang mesovarium siya is kaning the yellow one. Okay, kaning pinakalapad. Okay. Si mesometrium is mesovarium is kuan siya. So si mesovarium is its function is to help or makatabang to maintain or to stay in the position sa pelvis. Kay si mesovarium is a folded man siya nga naka-attach sa anterior portion sa kada ovaries hantod sa posterior part of the broad ligament. Pero ang mesovarium is not covering the entire surface sa kada ovaries, but naga-support gihapon siya. So ang mesovarium contains vessels, nerves, and smooth muscle fibers nga nakakonekta sa ovary. So next we have the mesometrium. It surrounds the uterus and is the largest subsection of the broad ligament. It runs laterally to cover the external iliac vessels, forming a distinct fold over them. The mesometrium also encloses the proximal part of the round ligament of the uterus. So saya po ganina no sa mesovarium is kaning red one. Kaning nag-hold kang ovary. Okay? So si mesometrium is ga-support sa uterus, tigsala sa mga fat site, and ang mesometrium kumbaga siya ang major nga nagbuog yun sa broad ligament. Okay? So the mesosalpinx originates superiorly to the mesovarium, enclosing the fallopian tubes. So mesosalpinx is kaning the yellow one, kaning pinakalapad. Sayo to ganina sa pinakauna na ko nga subdivision sa broad ligament. So ang mesosalpinx is it is a fold of peritoneum nga naay kuan siya maoy nagputos sa both uterine tubes. Sunod ang mesovarium nga naka-fold gud siya nga naka-attach sa anterior portion sa kuan kada ovary padulong sa posterior part sa ligament. Excuse me. But again, wala di cover ni mesovarium ang entire surface sa ovary, but to help the kuan ang position niya within the pelvis. So, anatomical relations. The broad ligament is related to many structures within the female pelvis. It is attached to the uterus, fallopian tubes, and ovaries. These organs are supplied by the ovarian and uterine arteries, which are also contained within the broad ligament. So, anatomical relations. 3 other ligaments of the female reproductive tract are located within the broad ligament: the ovarian ligament, round ligament of the uterus, suspensory ligament of ovary, also known as the infundibulopelvic ligament. So, Gerald Espana will be discussed that the anatomical relations. So now, unsa may kalahian ni mesovarium ug ni mesosalpinx? So according sa akong na-research, ang mesosalpinx daw is ga-enclose and ga-suspend siya sa uterine tube within the pelvic cavity. So and also it is encloses the anastomosis between the sa uterine ug sa ovarian vessels, while ang mesovarium is ang extension of broad ligaments nga ga-contain sa ovary. So, ang broad ligament is contain the structures which is the fallopian tubes. So, another is ang difference between ni ovarian ligament ug ni mesovarium. Okay, so ang mesovarium is the portion of the broad ligament, the uterus, that suspends the ovaries. So the ovary is not covered by the mesovarium, rather it is covered by geminal epithelium. Okay, and Gemini epithelium is a layer of cells covering the ovary, and naapod siya sa babae, naapod siya sa lalaki. So sa innermost layers testicle sa lalaki. So that's all my report. Gerald Espana will continue the report. Thank you.